Hello, this is Dr. X, a doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Natalie Portman, and I am 65 years.
Okay. How can I address you?
Please call me Natalie.
Okay, Natalie. Today we are going to discuss about your health issues. Will that be all right?
Okay, doctor.
During our discussion, I might take down some notes, which will be strictly confidential. Is it okay?
Okay, doctor. No problem.
Okay. Okay. Now, Natalie, can you please tell me in your own words what have brought you here today?
Actually, I'm suffering this for last 6 months. I noticed that I am becoming short. I am feeling shortness of breath while I am working. At first, it was on like heavy uh, walking or some doing running or jogging on that scale. But it is progressively incapacitating me to do my daily jobs. Even now, I cannot do my own jobs, own household jobs. I feel shortness of breath with that. Even now, I cannot walk around my house, or I cannot go out for go out to the market on walking. I feel shortness of breath. Sometimes even at night, I feel shortness of breath. I need to take extra pillows for that, and sometimes I need to stand. Sorry, but I need to sit from the line to relieve from this symptom. That is really affecting me.
Okay, I'm very sorry to hear. And I'm going to try to find out the cause behind it. You told that your problem started about 6 months back. Did it come along this shortness of breath? Did it come along suddenly or gradually? Can you please remember?
It was gradual, doctor. Initially, it was on just only one heavy exercise.
Okay, okay. And is it present all time now, or does it go away when you take rest or something like that? This
Taking
shortness of
some
breath.
rest makes me better, but lying down makes this condition worse.
Okay, okay. Is there anything that makes you feel better?
Just taking sitting down makes it somewhat better.
Okay, and okay, and you told that you have to use some extra pillows. Have you noticed that you have to wake up at night due to your symptoms? Have this ever occurred?
Yes, doctor. Uh,
Okay.
that initially when I didn't use extra pillows, I had to wake up at night from sleep usually after about 1 hour or 1.5 hour after sleeping. I needed to wake up
Mm.
just to get more air.
Okay. Okay. And can you have you noticed that is there any swelling in your legs or not?
No.
Okay, that's all right. And have you noticed that do you have any chest pain?
Yes, doctor. That is another issue. That when I feel shortness of breath on exertion or doing any exercise, I feel pain in my chest, and for that, my GP prescribed me one spray that is really helping.
Is it helping you?
Yes, doctor.
Okay. Can you please tell me that when did you first experience this pain, chest pain?
For last 6 months,
Okay. Did it come along suddenly or gradually? This pain?
gradually, doctor. Initially, I didn't pay attention to it. The pain came, then I take rest, and it went away.
Okay. And now, what's the matter? How long does it persist if you don't take that spray?
I haven't calculated it because I feel when I feel the pain, I usually take it, and after
Oh,
taking within 2 to 3 minutes, it's go.
okay. And how frequently do you experience this pain now?
When I do any exercise or any walking, even walking for a while brings this pain.
Okay. Has this increased in frequency, or has it been the same since the last 6 months? This pain.
No, it has been increasing, and now
Okay.
on mild walking brings this pain. Initially, this didn't bring the pain.
Okay. Well, can you please describe the pain for me? How does it feel like, this pain?
Pain is something like it's just pressing on my chest like that.
Yes. Okay. Does it go to anywhere else, this pain?
Sometimes over my jaw.
Over your jaws. Okay. And okay. And can you please tell me that if you how severe is this pain? Can you please tell me?
It's not so severe, doctor.
Okay. And can you please tell me that do you have any racing and pacing of your heart?
No,
Okay. Any cough?
no,
Any no tightness of of your chest or noisy chest?
no,
Okay. Do you have any raised temperature?
no,
Okay. Any changes in your nails? Have you noticed any?
no,
Okay. Well, have you noticed that you have been going on any color change? Any change of your color in the skin or something like that?
no.
Okay. And okay. And may I ask you some other questions? Do you have any headache?
No.
Okay. Any changes in your vision or any problem in vision?
Yes, doctor, I have some problem with my vision, and my doctor said that this is due to my age.
Age. Okay. 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 Well, have you been treated for this?
No,
Okay. And can you please remember what the diagnosis was? Did your doctor reveal it to you? The problem in your eyes.
said that there are some loss of some fibers in my eyes.
Okay. I can get it. Well, do you have any soreness in your mouth?
No,
Okay. Any rashes anywhere in your body?
no,
Any joint pain?
no,
Any difficulty in swallowing?
no,
Any difficulty in speech?
no,
Okay. Any weakness in any part of your body?
no,
Okay. Any lumps and bumps in your body?
no,
Any significant weight loss?
no, doctor.
Okay. And what about your water work?
I think it is same like before.
Okay. And what about your bowel movements?
I didn't notice any change.
Okay. And may I know that do you have any known diseases, long-term diseases like diabetes, high blood pressure, or anything like high blood lipid level, cholesterol level? Do you know of any?
I had some joint pain. For that, I am taking ibuprofen and paracetamol regularly.
Okay. Okay. For how long have you been having this joint pain?
That is a long time for last 8 years about.
For last 8 years. Okay.
Yes,
And okay, can you please tell me that which joints are involved?
my knee joint. My doctor said that it is called something joint. These pieces are damaged.
Okay. Okay. And can you please tell me that is this pain more while after you work or after you take rest?
After I work for a while, it comes.
Okay. 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 And is any other joint involved?
No,
Okay, that's all right. And are you allergic to any medication?
no,
Okay. Any over-the-counter medication?
no,
Okay. Any herbal medication?
no,
A personal question. I'm sorry to ask. Do you take any recreational medication?
no, doctor, never.
Okay, okay, that's all right. Very good. And any family history of heart attack or stroke? Can you remember, or diabetes, high blood pressure, or any other chronic disease?
My father had a heart attack when he was
At which age?
at his age of 60.
60. Okay. And do you have any history of sudden death in your family?
No.
Okay. Any okay. And may I ask you that again some personal questions? Do you smoke?
No.
Okay. Do you drink alcohol?
No.
Okay. May I know that do you have any pet in your house?
Yes, doctor.
Okay. Can you please name the pet?
I have some pigeons at my house. I
Okay.
really like them.
Okay. Well, may I know that from how for how long have you been maintaining these pigeons in your
For
house?
this was for about 1 year.
Okay. 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 And well, may I know that actually it's I'm sorry to ask, but may I know that do you use any protective masks or gloves while handling these pigeons?
No.
Okay. Well, do you notice that? Well, okay. And well, may I know that what do you do for a living?
Now I am not doing anything. I was a school teacher.
Okay, okay. And may I know that well, when you go move out from your house, do you feel any changes in your symptoms? Like when you go to any other house, do you feel that you are getting better in your symptoms?
No.
Okay, that's all. And well, are you well supported socially and economically?
I am living with my husband, doctor, and he has severe dementia. I have to take care of him. And we
Yes.
have no children, so that is actually an issue that I am facing.
Okay. Well, yeah, yeah. I will involve the social services as soon as possible to help you in this matter. And may I know that do you drive?
No, 2 minutes
Okay,
remaining.
well, okay, and well, I can I'm sorry to ask, but some personal questions. Do you use any pills?
What type of pill, doctor, at my age?
Any? Well, actually, there are some pills that can after your menses stop. Actually, there are some pills that can prevent your bone loss and help you feel
No.
better. Do you use any? Okay, okay. And well, may I know? I think that your another personal question. I think your menses have stopped. Am I right?
Yes, doctor, long before.
Long ago. Okay. And may I know that do you have any loss of pregnancy?
No.
Okay. Okay. And okay. And I guess that's all right. May I know what your concern is?
Why I am having this, doctor? Is it a heart attack?
Yeah, well, actually, as long as we have uh, taken history, at first we have to examine you properly and also do a thorough assessment of you. Then we can give you a more detailed explanation. But as long as we have taken your history, uh, it might seem that you might be having some heart issues. Okay, we are not completely sure about it. We will have to run some blood tests and also do the electrical tracing and do you do the scanning of your heart to see what your heart condition. We will also involve the heart doctor and other consultants so that they can help you in this matter. However, there are some possibilities of your deterioration of the symptoms that uh, for one is that you have been having a long time uh, okay, some paracetamol and painkillers, and at times these painkillers can affect um, the heart as well. So we have to look into that matter. And again, there is another issue, although it is less likely, but you have some pit in your house. So at times this pit can also affect your breathing and breathing. So these issues are to be addressed. So we will actually first do the test and then map out a plan for you. Is this okay?
Okay, doctor.
Any more questions?
Do I need admission?
Well, at this moment, since you very often feel chest pain, it's likely that we will keep you some under observation until we get your test results back. Okay, is that all right?
So I need to be present at hospital now.
We will actually uh, involve our consultant
Enough.
here to take a decision on whether to keep you admitted or not. Will that be okay?
Okay, doctor.
Okay. Any more concerns?
Can you do that as soon as possible because my husband is at home. I told you that he.
Yeah. I have already told that we will involve the social services, and we will. I will just go to our consultant and tell him about your issues and try to do your tests as soon as possible. Is that okay?
Okay.
Okay. Thank you.
So what is your diagnosis?
Uh, well, actually, based on the symptoms that she has, I think that there might be some possibilities. The most likely possibility uh, maybe his some NSAID induced heart failure. I think not heart failure maybe, and also regarding her pet maintenance, although it's unlikely, but I think that extrinsic allergic alveolitis can also be brought as a DD, and also her symptoms may go in favor of stable angina. Regarding her age issues, stable angina can also be a possibility, although she doesn't have risk factors present except her age.
Okay. What do you mean by NSAID induced heart failure? I cannot get it.
Well, actually, NSAID can cause actually fluid retention. So this can be this can cause pressure in the heart. I think so. That might be a cause of it. Guess.
I think this can be simply a heart failure, whatever the cause. There are a lot of causes because she may have anemic heart failure.
Yeah. 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 This can be just a simple case of heart failure also.
Just keeping the diagnosis heart failure, vestibular angina will be fine, I think.
Yeah.
I will investigate.
Okay. Okay. For investigation, at first I will go for some routine blood tests like CBC, ESS, CRP. Then I'll have to go. I'll again have to do some blood tests like troponin I levels, and do some tracing like ECG, and also do some um, echocardiography involving the cardiologist, and we might also do some blood tests like BNP, B natriuretic peptide, and BNP, and also uh, do serum urea, creatinine, and electrolytes for to look about his renal function, and also we will have to do some chest X-ray view to see whether pulmonary edema is present or not, and her heart condition.
Okay, what are
And also we might go for exercise test, but which will need specialist jurisdiction. Okay, if needed, we might go for angiography.
I think this exercise test isn't used now.
Yeah.
Whether it is used
I think we can go for scanning test, oxygen scanning.
perfusion test.
Yeah.
Okay. Uh, what the drugs have positive effect on heart failure?
Yeah, actually, in acute cases, there are some drugs like loop diuretics, fusamide. Okay, they can also be used in long term, but they usually don't have that much effect on prognosis. But there are some other drugs also like beta blockers, if unless contraindicated, and also ACE inhibitors. Yeah, and ACE inhibitors, and at times some special channel blockers like ivabradil, nicorandil, this can also be thought of, and if according to indications, we can also think about ICD, implantable cardiac defibrillator, or the CRT, cardiac resynchronization therapy. And modern drugs, there are some drugs like nebulizer inhibitors also, but it will be selected by specialists. And we have to advise the patient and counsel him to have some special positions like propped up positions, and involve the emergency whenever she feels shortness of breath. Okay,
I
to
think
have her oxygen
I
saturation.
think you are not answering my questions.
Okay, okay. Can you repeat again, please?
Okay, forget it.
Okay, okay.
The history taking, I think you have done well. You
Okay.
have differentiated cardiac cause or respiratory cause. I think you could have asked about uh, have you did anyone said that you are getting pale day by day just to
Hmm.
exclude anemic heart failure,
Hmm, 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 hmm,
basic
hmm.
weakness or lethargy
Yeah, 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 yeah.
or heart failure, any thyroid issue. I cannot remember if you have asked or not.
No, I didn't.
Okay, and also she's taking ibuprofen paracetamol for a long time. So has she ever noticed any blood issue or passed any blood in issue?
Yeah, 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 yeah. I can get it.
And she has also said that she's using more pillows at night.
Hmm.
Yeah, that can she sleep now with more pillows or it is not helping? You have
Hmm.
asked it.
Hmm. Hmm, hmm.
Overall, this was fine.
Okay. Okay. So, what was the precipitant in this case? Just
Actually, this lady is already 65 years.
okay. Yeah, yeah.
So age is
Okay.
factor for this.
Okay. So, I think that's done. This case. Okay.